All right, we'll go ahead and get started here. So just want to welcome everyone to Open House. My name is Scott Heinrichsen. I'm the head athletic trainer at St. Francis. And so just want to talk a little bit today, cover a couple things. Just want to talk about our staff and then a little bit about what we do. We have a couple of guest speakers here. So they're going to talk a little bit about our program, both from a student perspective and from an athlete perspective. And then we'll have a little bit of time at the end to talk about for a little Q&A. And if somebody does have any questions, we'll feel free to ask. Again, my name is Scott Heinrichsen. I'm been at St. Francis now. This is my 7th year, 25th overall as an athletic trainer. And we're fortunate enough to have, at our level, we have a very good sports medicine staff. So we have 2 full-time athletic trainers. We have myself and we have Laura Acidello, who's also on our call. We also have Dr. William Straw, who's our team physician, and he's been the team physician at St. Francis now for about 38 years. So we have a wide variety of experience. I myself, I've worked everywhere from high school and youth sports all the way up to professional sports. So I feel like I bring a pretty good range of perspective. Laura is amazing. She's been a great add for us. And again, Dr. Straw is he's done so much for us as a school and just as a sports medicine person. A little bit about my background. I did my undergrad at San Diego State. Graduated in '95. Got my master's from the University of Northern Colorado, and then went from there went into work at a physical therapy clinic. So I have a little bit of clinical experience. Also worked at a small college, and then moved on to Santa Clara University, where I worked for 15 years. And again, now on my 7th year at St. Francis. So I'll turn it over to Laura now. She'll talk a little bit about herself and then a little bit more about what we do and what we provide St. Francis athletes.
Hi, everybody. I'm Laura. I'm the assistant athletic trainer. So I'm just going to share my screen real quick. Got a little short presentation before I hand it over to the students. So that's Scott on the left. He just introduced himself. I'm Laura again. This is my 4th year at St. Francis and my 7th year. My 7th year as a certified athletic trainer. I did my undergraduate at Chapman University and my graduate at LaSalle College. All of my research throughout my undergrad and my graduate was about concussions and post-concussion care. I pretty much have always worked in the high school setting. I've worked in high schools pretty much all over California. So I've seen the different range between Northern California and Southern California and how they work a little bit differently, but it's been really fun to see different perspectives of at the high school level. Our hours, so we're on campus from 10 a.m. to 7 p.m. So pretty much 7 p.m. or the end of the last athletic competition that's happening on campus. Essentially during the school day, we're there for any students that have a little bit of a longer term issue. So they're post-surgery or they have a more serious injury that requires a lot more rehabilitation. We're there a lot during those school day hours for them to work with us. As well as after school, we provide any of that taping, stretching, evaluations, getting them out to practice, getting them out to games. In general, we're there to provide first aid care, evaluate injuries, give rehabilitation plans as needed. We do all concussion evaluation management on campus, and as well as refer out to physicians as we need. And for all of our contact sports, we're there on the sideline for any kind of that first aid care, like I said, any of that on-field evaluation or off-field evaluation. That's pretty much what we're there for. We're there just to ensure the safety and the health of all of our athletes. And I know we can't be on campus together, which you would see a tour. So this is a picture of our facilities. If you can see on that left picture, we have 4 treatment tables, and that's where we do all of our injury evaluation and care and some of the rehabilitation for the kids. You can see some of the equipment in the back there, some of our Swiss balls, our mirrors, we have bands hanging from the walls, any kind of equipment might need for athletes to kind of get back from their injuries. As well as in that middle picture, you can see those 2 tables. Those are a little bit taller next to the door. Those are our taping tables. We usually use those before practices and games just to tape ankles, tape wrists, do a little first aid care, anything we might need for athletes to be out there on the field. And then all the way on the right, with our hydro room. So we have 2 ice baths, and those are filled every single day. Athletes are welcome to use them after practice or after games or coming back from a long tournament weekend. We do have some rules with those. I won't go over them now because it's kind of boring, but we do have those 2 filled, as well as in the back. On this first picture, you can't really see it, but we do have our doctor's office, and that's for Dr. Straw. And he's Scott talked about him. He's on campus once a week with us every Wednesday, as well as he comes to all of our football games and our basketball games. So he's on the sideline for all of those. And as you can see, we're also connected. I don't know if you can see it actually. On the right, we're connected right to the weight room. So it's really great to be able to have kind of quick access to that weight room and those open windows so we can see what's going on. So especially for rehabilitation, having that extra space and access to all that equipment that we might need is a great asset for us.
He called me.
So that's kind of it on my end from me. So I'm gonna stop sharing real quick. I'm gonna turn it over to Clayton Lynham, who's one of our athletes, and he's just gonna kind of share a little bit about his experiences.
Yeah, hi guys, I'm Clayton, and I'm a junior at St. Francis, and I've been playing football since like 3rd grade, Pop Warner, and I actually, I was invited to talk at this because I had shoulder surgery actually on Thanksgiving last year, so coming up on 1 year, but I was having problems with like dislocating my shoulder, and it was a torn labrum muscle, and it needed to be like fixed and tightened up. And honestly, like without Scott, I would have no idea understanding it as much as I do now. And I knew that like going in, I would want to go see Scott for my physical therapy, and it really did help me out. And I would go in after school every single day before, and I was in a sling, but I went from not being able to like lift my hand at all to like a full range of motion with my left arm, and it's just, I don't know, I couldn't ask for more from our trainers because they helped me out so much. So I'm really grateful for that. Yeah, and I could talk a little more if there's any questions.
We'll hold questions for the end, but thank you, Clayton.
Yeah.
And turn it over to Madison, and she's going to talk on the other side about our sports medicine club.
Okay, so I'm Madison. I'm a senior, and I've been working as a student aide in the sports medicine program since my freshman year, like towards the spring season. So I joined because at that point, I've already volunteered at a few other facilities, like at the Menlo Park VA Center, and like I helped with the physical therapist there. And I wanted to continue doing that in a school environment when I found out that you could volunteer as one. It gave me a lot of opportunities to learn how to like deal with the more athletic trainer side of things. So like taping injuries, getting ice, evaluating injuries and stuff like that. You get to do a lot of other things like working on the sidelines of some games. Like I remember one of the front row ones were like working at the wrestling matches because those are always pretty fun. Some other things that I've learned is learning about the different body systems and stuff. Like we've had tests where we kind of memorize where different structures of the body are, like of the ankle or like of the arm. One of my favorite things about it is that it just gives a really nice community to kind of just learn about a more career-oriented studies rather than just kind of like maybe in psychology class at school, you kind of just learn from the book, but this is more of a hands-on experience. And I think that the past 4 years have been pretty good here. So Thanks.
Thank
Awesome,
you.
thank you.
Yeah. So we'll turn it over. So if anybody has any questions, feel free to shoot them out at us, and we'll see if we can answer them.
Okay, how are people chosen to join the sports medicine club? So I'll take that one over. It's pretty easy. So I run that club. You basically have to just come in and talk to me, and I will give you, or shoot me an email, and I will give you our handbook as well as our application. I have had to implement an application just because of the higher volume of interest in it. But it's a super easy application. It's 1 page long. It's basically just saying, like, what do you want to do and why do you want to join us and what do you hope to get out of it? You read through our handbook and you kind of make sure that has kind of all of our rules and what we want. And once we get through all that, as long as that's all good and we have room, then we can kind of set up a meeting and we can have you join us. And our students usually are there for 1 to 2 afternoons a week, depending how many students and spaces we have. In general, we're kind of capped at a max of about 16 to 17 students is about the maximum amount of students we can have. And that's just because per afternoon, we can't have more than 3 to 4 students working in the athletic training room, just because it gets really crowded, because we see anywhere from 60 to 70 athletes sometimes in an afternoon. And our staff has to be limited in the space. We can't take up most of the space. So, and as well as we want to make sure that each student that's working is getting as much out of it as they can and learning as much as they can without having to compete or anything like that. So that's pretty much it. It's super simple. Just talking to me, application, handbook, conversation. As long as we have space, then it's there. And if we don't have space, I do have a waiting list that I keep up to date and I keep with when people will kind of inquire about the club. And so I do keep that. So we do go by sporting season. So a lot of athletes will not be in the fall, or a lot of athletes that are student aides won't be in their fall because they have fall sports, so we'll have openings, or vice versa in the winter or the spring or whatever it is. So yeah, easiest way is just come talk to me.
Great. Do you have any other questions?
Yeah, I have a question.
Mm-hmm.
So I have like an interest in medicine, but like if you don't have any experience in medicine, is there a chance you could still like join this club? So like, will you have like lessons on how to like do this?
Yeah, so I honestly don't expect anyone to have any experience. You guys are just, 8th graders coming into high school and kind of seeing a lot of things for the first time. When you do join our club, when I say application, it's mostly just to see what you want out of the club and what your interests are. I don't expect, like I said, to have anybody to have a whole bunch of background. It's not competitive in kind of that sense of the word. But we never expect you to do anything that you're not comfortable with. As well as when you join, we start you at pretty much assuming that you have zero knowledge at all. And you'll learn from the students that are older than you, and you'll learn from us, and we'll teach you how to stretch, we'll teach you how to tape, we'll teach you how to take that history for injuries, but we'll start you out really small. So generally the first thing we start out with is stretching, because most people know how to stretch in general anyways. So teaching you how to stretch, and then you'll start with stretching the athletes when you're comfortable, and then teaching you basic tape jobs, and then you practice on each other first, and you can practice on us a little bit, and then when you feel comfortable and when we feel that you are confident enough, we'll let you do it on the athletes. And then, when you're comfortable, when we feel that you've done really well and you're working with athletes really well and that's really well, and you're comfortable working with athletes, and we'll have you doing some exercise teaching or some history taking or things like that. So everybody pretty much starts with a clean slate. That's pretty much what I expect and pretty normal. And then we're hoping that you're learning along the way and learning these skills and growing. And like Madison has grown exponentially as her senior from when she was a freshman working with us. And I hope she's learned a lot, and just seeing she can pretty much run the athletic training room if she really wanted to without us. She can actually, but well, we're always there. We never leave them alone. But she's very competent, and that's something that she's learned a lot over these 4 years.
Great. So do you have any other questions? Well, thank you guys for coming out. We do appreciate it. Laura and I we'll be hanging out here for a little bit. So if anybody does have anything, we'd be happy to answer. And we wish you luck with your hopefully St. Francis career. Thanks, guys. Thank you guys for coming out. Really appreciate it.
Thank you.
No problem. That was good.
Yeah.
Guys enjoy it.
All right. Enjoy the rest of your Sunday.
Alrighty.
Bye.
Thank you.